Hello everyone, this is Dr. Sam and this video is about scrotal ultrasound reporting. You will learn how to write the findings and the impression regarding scrotal pathologies on ultrasound. We will start with a normal report. You can start the findings by writing scrotal ultrasound was performed in both the transverse and longitudinal planes using a high-frequency linear array transducer. After that, you can write the size of the testes. You can write the measurements of the right and left testes. In this normal report, both testicles demonstrate normal size, shape, and echo texture. No focal lesions or masses are identified. Then you can write the appearances of the epididymides. Both appear normal in size and echogenicity. No cystic or solid masses are visualized. There is no evidence of epididymal enlargement or inflammation. After that, you can write the appearance of the spermatic cords. The spermatic cords bilaterally demonstrate normal thickness and vascularity. No abnormal masses, dilatation, or tortuosity are noted. The scrotal wall is intact without evidence of thickening, inflammation, or herniation. Finally, you can write the impression. This scrotal ultrasound examination reveals normal findings. No significant abnormalities are detected within the scrotal contents, including the testicles, epididymides, spermatic cords, and scrotal wall. This is a case of polyorchidism. First, you can write the sizes and appearances of the testicles. In this example, they were normal. In polyorchidism, there are more than 2 testes. So adjacent to the left testicle, there is a smaller additional testis measuring 3.2 into 1.6 into 2.2 centimeters. It exhibits normal echo texture and vascular flow consistent with a supernumerary testis. And after that, you can write about the appearances of the epididymides. In this case, they were normal. No hydrocele, varicocele, or evidence of extratesticular mass or fluid collection is identified in either scrotal sac. Here is the impression. Sonographic findings are consistent with polyorchidism with a supernumerary testis identified on the left side. All testes and epididymides appear unremarkable. Urological consultation is recommended for further evaluation and management. This is a report for Cryptorchidism. There is an atrophic left testis. Here are the findings. The right testicle was normal in size, shape, and echo texture, and it also had normal vascular flow. The left testicle is not visualized in the scrotal sac. Instead, a small atrophic structure measuring 1.3 into 0.6 into 0.9 centimeters is identified in the inguinal canal, which is consistent with an undescended atrophic left testis. This shows decreased vascularity compared to a normal testis. The right epididymis appears normal in size and echo texture. The left epididymis is not identified with the atrophic testis. No hydrocele, varicocele, or evidence of extratesticular mass or fluid collection is identified in either scrotal sac. Here is the impression. Sonographic findings are consistent with left-sided cryptorchidism with a small atrophic testis in the inguinal canal. The right testis appears unremarkable. Urological consultation is recommended for further evaluation and potential management of cryptorchidism to mitigate risks of complications. Now we will look at a hydrocele. Here is the clinical history. The patient presented with scrotal swelling and discomfort. Then you can write about the scrotal contents. A significant fluid collection is identified within the scrotal sac, consistent with a hydrocele. The fluid appears anechoic and no internal echoes are noted. After that, you can write the appearances of the testicles. They were both normal in size, shape, and echotexture. The epididymides were also normal in size and echogenicity. Both the spermatic cords demonstrate normal thickness and vascularity. There were no abnormalities noted. The scrotal wall is intact without evidence of thickening or inflammation. And finally, you can write the impression. The scrotal ultrasound examination reveals the presence of a hydrocele. The hydrocele is characterized by a significant fluid collection within the scrotal sac, causing enlargement and discomfort. The testicles and epididymides appear normal. Clinical correlation and further evaluation may be necessary to determine the underlying cause of the hydrocele and to assess the best course of treatment for the patient's scrotal swelling and discomfort. Here is the report for Encysted spermatic cord hydrocele. The patient had a history of painless scrotal swelling. Here are the findings. The right and left testicles were normal in size, shape, and echotexture. A well-defined cystic structure is identified adjacent to the right testicle within the spermatic cord. The cystic structure is compressible and measures approximately 2.1 into 1.8 into 1.6 centimeters. This finding is consistent with an encysted spermatic cord hydrocele. Besides this hydrocele, no other abnormalities were found. This is the impression. A well-defined cystic structure adjacent to the right testicle and within the spermatic cord is consistent with an encystic spermatic cord hydrocele. Clinical correlation and monitoring are recommended to assess for any changes in size or symptoms over time. Now we have a case of funicular spermatic cord hydrocele. In the findings, the testicles were normal. A fluid collection is identified along the course of the right spermatic cord, extending from the external inguinal ring to the upper pole of the right testicle. The fluid collection is compressible and its size is written. The finding is consistent with a funicular spermatic cord hydrocele. In the impression, you can mention the fluid collection along the course of the right spermatic cord, extending from the external inguinal ring to the upper pole of the right testicle, which is consistent with a funicular spermatic cord hydrocele. You can end the impression by writing about clinical correlation and further management. This is a case of Pyocele. Due to repetition, the normal findings of the testes and the epididymis, as well as the spermatic cord, have been removed. Only the concerning finding regarding the pathology is shown. For the Pyocele, a fluid collection is observed within the right scrotal sac surrounding the right testicle. The fluid appears heterogeneous and contains internal echoes, suggestive of a Pyocele. No definite blood flow is seen within the Pyocele on color Doppler imaging. You can write the main findings in the impression as well. A fluid collection within the right scrotal sac surrounding the right testicle appears heterogeneous with internal echoes consistent with a Pyocele. Clinical correlation and urgent medical intervention, including drainage and appropriate antibiotic therapy, are necessary for the management of a Pyocele. These are the findings regarding a Scrotolith. A single small echogenic focus is observed within the right scrotal sac. The focus demonstrates posterior acoustic shadowing and is consistent with a Scrotolith. A significant fluid collection is identified within the right scrotal sac surrounding the right testicle. The fluid appears anechoic and compressible, indicative of a hydrocele. In the impression, the main findings of the Scrotolith and the hydrocele are mentioned, and you can end the impression with the lines of clinical correlation and further evaluation to determine the cause of the hydrocele and assess the Scrotolith. Here are the findings of a Tunica Albuginea cyst. A well-defined cystic structure is observed next to the right testicle and its size is written. It demonstrates an anechoic appearance with smooth borders and has a paratesticular location. In the impression, you can mention a well-defined cystic structure observed outside the right testicle, consistent with a Tunica Albuginea cyst. Clinical correlation and monitoring of the Tunica Albuginea cyst may be recommended to assess for any changes in size or symptoms over time. Surgical intervention may be considered if the cyst enlarges significantly or leads to discomfort. In tubular ectasia of Rete testis, there are small multiple cystic structures. The cysts have no internal vascularity on Doppler. These cystic structures demonstrate anechoic contents and are seen in both the peripheral and central regions of the testicular parenchyma. Findings are consistent with tubular ectasia of the Rete testis. In the impression, you can write, there is evidence of tubular ectasia of Rete testis within both testicles. No other significant abnormalities are identified within the testicles or epididymides. In a varicocele, a dilated and tortuous vein is observed within the left scrotal sac, consistent with a varicocele. It measures approximately 3.1 millimeters in diameter. Color Doppler imaging demonstrates retrograde flow within the dilated vein during Valsalva maneuver, confirming the diagnosis of a left varicocele. Here is the impression. The scrotal ultrasound exam reveals bilateral testicles with normal size, shape and echo texture. No significant abnormalities are identified within the testicles or the epididymides, except for a left varicocele. Clinical correlation and further evaluation may be necessary to assess the severity of the varicocele and determine the appropriate management. In limited testicular microlithiasis, microcalcifications are seen within the testicular parenchyma. Usually they are less than 5. In the findings, few small echogenic foci consistent with microliths are scattered within the testicular parenchyma. They appear stable with no significant change in size or distribution compared to previous examinations. So this patient had a history of limited testicular microlithiasis. You can mention the microlithiasis in the impression. No other significant abnormalities were found. Clinical correlation and regular follow-up may be recommended to monitor the microliths for any changes and ensure the overall health of the testicles. For a case of classic testicular microlithiasis, you can write multiple small echogenic foci consistent with microliths are scattered throughout the testicular parenchyma of both testicles. These calcifications are mentioned in the impression. There were no other significant abnormalities. Clinical correlation and regular follow-up are advised to monitor the microliths for any changes to ensure the overall health of the testicles. For a diffuse testicular microlithiasis, numerous small echogenic foci consistent with microliths are diffusely distributed throughout the testicular parenchyma of both testicles. The microliths are present in multiple regions of both testicles. Besides these microliths, no other significant abnormalities are identified within the testicles or the epididymides. And just like the previous cases, clinical correlation and regular follow-up may be advised to monitor the microliths for any changes. This is a scrotal ultrasound report of sarcoidosis. The patient had a history of sarcoidosis. Both testicles demonstrate multiple hypoechoic nodules of varying sizes within the testicular parenchyma. The nodules appear diffusely distributed throughout both testicles. Additionally, the epididymides show signs of hypoechoic nodules as well. Color Doppler imaging shows increased vascularity within the hypoechoic nodules, indicative of neovascularization associated with the nodules. The hypoechoic nodules found within the testicular parenchyma and epididymides are mentioned in the impression. Clinical correlation and further evaluation is recommended. Additional tests such as blood tests, chest X-ray, and biopsy may be performed to evaluate the extent of the disease. Cystadenoma of Rete testis is a rare benign tumor. In the findings, a well-defined cystic mass is observed. It appears anechoic with multiple septations. The cyst demonstrates posterior enhancement, resulting in increased sound transmission beyond the cystic structure. You can write the main features in the impression. The cyst appears anechoic with multiple internal septations, which may suggest cystadenoma of the Rete testis. Clinical correlation and further evaluation, such as blood tests or imaging, may be necessary to confirm the diagnosis and to determine the appropriate management. Here we have a case of a hyperechoic mass within the testis. Usually it is a lipoma. A well-defined hyperechoic mass is identified within the right testis. Its size is written. It demonstrates homogeneity in echo texture and has smooth borders. This is the impression. Scrotal ultrasound examination reveals a hyperechoic mass in the right testis, suggestive of a lipoma. Clinical correlation and further evaluation may be necessary to confirm the diagnosis of the testicular lipoma. Here is a report for fibrous pseudotumor. A well-defined hypoechoic and heterogeneous mass is identified within the scrotal sac. It demonstrates heterogeneous echo texture with areas of increased echogenicity and hyperechoic strands. A hydrocele is observed surrounding the testicles bilaterally. The hydrocele appears as a well-defined anechoic fluid collection. You can write the main findings in the impression. These findings may suggest a fibrous pseudotumor. Clinical correlation and further evaluation, such as a biopsy, may be necessary to confirm the diagnosis of the fibrous pseudotumor. An adenomatoid tumor is a paratesticular tumor, which means it grows outside the testis within the scrotal sac. Here are the findings. A well-defined homogeneous round nodule in the left hemiscrotum measuring 1.5 centimeters in diameter is visualized. The nodule is hyperechoic to the surrounding testicular parenchyma. No vascularity is seen within the nodule on color Doppler imaging. Here is the impression. A well-defined round nodule is located within the left testis. Differential diagnoses include adenomatoid tumor and peritesticular lipoma. Clinical correlation and further evaluation, such as a biopsy, may be necessary to confirm the diagnosis of this mass. This report is of a testicular lymphoma. In the findings, the right testis is enlarged and heterogeneous in echo texture. There are multiple hypoechoic foci within the testis, some of which are ill-defined. Color Doppler imaging shows increased vascularity within the testis. The left testis is normal in appearance. There is a hydrocele surrounding the right testis. This is the impression. Right testicular lymphoma with associated hydrocele is the most likely diagnosis. Further evaluation with testicular biopsy is recommended. CT scan of the chest, abdomen and pelvis, tumor markers and complete blood count are recommended. Patient to follow up with urologist for further management. Now we have a case of testicular metastasis. The patient has a history of colon cancer which was diagnosed 5 years ago. He has been in remission since then. Here are the findings. The right testis is enlarged and heterogeneous in echo texture. There are multiple hypoechoic and heterogeneous foci within the testis, some of which are well defined. Color Doppler imaging shows increased vascularity within the testis. The left testis is normal in appearance. There is no hydrocele. In the impression you can write right testicular metastasis is the most likely diagnosis. Further evaluation with testicular biopsy is recommended. Patient to follow up with urologist for further management. Now we have a report of scrotal hernia. There is a small indirect inguinal hernia located in the right inguinal canal. The hernia sac contains a small amount of fluid and fat. There is a large hydrocele surrounding the right testis. The left testis is normal in appearance. No hydrocele noted in the left scrotal sac. In the impression you can write right indirect inguinal hernia with hydrocele. Patient to follow up with urologist for further management. This is a report for testicular torsion. The indication is right scrotal pain. These are the findings. The left testis is enlarged, hyperechoic and heterogeneous in echo texture. There is no blood flow to the left testis on color Doppler imaging. The left spermatic cord exhibits a twisted whirlpool appearance on color Doppler. Findings are consistent with left testicular torsion. Left testicular torsion is written in the impression. Immediate surgical exploration is recommended. Now we have a case of partial torsion. The right testis is slightly enlarged and heterogeneous in echo texture. There is decreased blood flow to the right testis on color Doppler imaging. The left testis is normal. In the impression, the partial right testicular torsion is mentioned. Observation and serial ultrasounds are recommended. Here is a case of orchitis. There is inflammation of the testis. The right testis is enlarged and hypoechoic with increased vascularity on color Doppler imaging. There is scrotal wall thickening. The left testis is normal. The ultrasound findings in this patient are consistent with orchitis. The right testis is enlarged and hypoechoic, which is indicative of edema and inflammation. The scrotal wall thickening is also consistent with inflammation. The increased vascularity on color Doppler imaging is due to increased blood flow to the testis. Follow-up with a urologist is recommended. Here is a report for focal orchitis. The right testis is normal in appearance, except for a focal hypoechoic area in the upper pole. There is no scrotal wall thickening. Increased vascularity on color Doppler imaging within the focal hypoechoic area is noted. The left testis is normal. In the impression you can write the main features, and after that you can write differential diagnoses include focal orchitis and primary malignancy. Follow-up is recommended for further evaluation and monitoring. This is a case of testicular rupture or infarct. The patient presented with acute scrotal pain following trauma. The right testicle demonstrates heterogeneous echo texture. There are areas of disrupted and irregular parenchymal architecture consistent with testicular rupture. Additionally, a significant hematocele is noted surrounding the testicle, indicating the presence of blood within the scrotal sac due to the trauma. The left testicle also exhibits heterogeneous echo texture and disruption of the parenchyma, indicative of testicular rupture. A hematocele is also identified surrounding the left testicle, confirming the presence of blood within the scrotal sac. This is the impression. This scrotal ultrasound examination reveals bilateral testicles with heterogeneous ecotexture, suggestive of disrupted and irregular testicular parenchyma in both the right and left testicles. The findings are highly indicative of testicular rupture. Additionally, significant hematoceles are observed surrounding both testicles, indicating the presence of blood within the scrotal sac, which is commonly associated with testicular trauma and rupture. The patient should be promptly referred to a urologist for further evaluation and surgical management. This is a report for testicular fracture. The right testis displays heterogeneous echogenicity with an area of focal discontinuity seen in the lower pole, consistent with a testicular fracture. Surrounding this area, a hypoechoic region is noted, suggestive of a hematoma. Color Doppler reveals decreased blood flow within the fractured region compared to the rest of the testicle. This is the impression. Sonographic findings suggestive of a right testicular fracture with associated hematoma. Urgent urological consultation is recommended for further evaluation and management. Here is a case of seminoma. There is an 8 mm well circumscribed homogeneous hypoechoic lesion in the lower pole, which shows increased vascular flow on color Doppler. This is suspicious for a testicular neoplasm, potentially seminoma. The remaining testicular parenchyma appears normal. The sonographic findings are suggestive of a mass in the left testicle, potentially seminoma. The right testicle and both epididymides are unremarkable. Immediate urological consultation is recommended for further evaluation and management, including serum tumor markers and possible biopsy. Here is a report for embryonic cell carcinoma. There is an irregularly shaped, heterogeneous, predominantly hypoechoic mass in the lower pole, which shows increased vascular flow on color Doppler. The mass is suspicious for a testicular germ cell tumor. Embryonic cell carcinoma is not declared in the impression. Only the main findings are written. Urgent urological consultation is recommended for further evaluation and management, including serum tumor markers and potential biopsy or orchiectomy. This is a report for testicular teratoma. Within the right testicle, there is a complex mass. The mass is heterogeneous in ecotexture, containing both cystic and solid components, as well as areas of calcification. The mass shows mild vascularity on color Doppler examination. The features could be consistent with a germ cell tumor, such as a mature teratoma. The remaining testicular parenchyma appears normal. The main findings are written in the impression. An immediate urological consultation is recommended for further evaluation and management. In epidermoid cyst, there is a well-defined avascular hyperechoic lesion with a hypoechoic rim, that is, an onion ring appearance, suggestive of an epidermoid cyst. You can mention the epidermoid cyst in the impression, and you can advise urological consultation for further management. Here are the findings of a burned out testis tumor. There is a hyperechoic mass with calcifications and a well-defined boundary. This area shows no vascularity on color Doppler examination, which may suggest a calcified, burned out tumor. The remaining testicular parenchyma appears normal. This is the impression. The main features are written and urological consultation is recommended. Epididymitis is the inflammation of the epididymis. The epididymis is enlarged and shows increased vascular flow on color Doppler, suggestive of epididymitis. This is the impression. Sonographic findings are suggestive of left-sided epididymitis with secondary mild hydrocele. Urological consultation is recommended for further evaluation and management. Here is a report for epididymal abscess. The right epididymis is normal. The left epididymis is markedly enlarged and hypoechoic with loss of normal architecture. A complex fluid collection with echogenic debris and a well-defined wall is seen within the left epididymis, suggestive of an abscess. There is increased vascular flow surrounding this area on color Doppler. Moderate hydrocele is seen on the left side, likely reactive. The right scrotal sac appears normal with no hydrocele or varicocele. No evidence of extratesticular mass or fluid collection. The left-sided epididymal abscess with associated hydrocele is mentioned in the impression, and urgent urological consultation is advised. This is a report for epididymal head cyst. There is an anechoic, well-circumscribed cystic lesion at the head, consistent with an epididymal cyst. The main findings are written in the impression, and urological consultation is recommended for further evaluation and management if the patient is symptomatic. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.